So my name is Dr. Julia Pullin and I'm the founder of the Chiro Health Clinic. Now, I heard that you'd missed the workshop this week, but that's not a problem. So what we decided to do was actually send you a little video which summarised what we covered, what we learned, so basically you didn't feel like you'd missed out. Okay, so what we're going to be covering today, we are first of all going to cover the facts about low back pain and sciatica. We're going to run through some anatomy. We're going to run through the common mistakes that people make when they have low back pain and sciatica. And then finally, we're going to tell you what you can actually do about it yourself. So I've been a chiropractor now for almost 25 years, so I've probably seen most situations now. And what I can tell you is that low back pain and sciatica is phenomenally common. I mean, the reality of the situation is it's about 80% of us that will get a bad back at some point in our lifetime. As to whether we develop the sciatic symptoms, so the leg pain as well, that will depend on what structures are involved. And we'll be covering that in a little bit more detail shortly. The impact of low back pain it is a global problem. I mean, the reality of it is low back pain is the leading cause of disability worldwide. So here's a few UK stats for you. I'm not a numbers person, so I have written them down. So let's have a look. So 5 million lost working days due to low back pain just in the UK alone. 5 million. So that's absolutely huge. Then also the cost to the nation is £5 billion per year, and this is an estimated cost that they've made. So yeah, it's a significant issue that we're dealing with when we're looking at low back pain and sciatica, and it really does have a massive impact on our daily lives. What we're going to do now is start running through a little bit of the anatomy so that you can understand what's actually happening. So I'm about to go grab my spine. Okay, right then. So what we have is the pelvis down here at the bottom, which is made up of iliac crests over here, sacrum in the middle, coccyx down at the bottom, a little wiggly bit at the bottom. We have 24 vertebrae running up through the spine, okay? And then each of them are separated by little joints, which hopefully you can see just there, okay? And those little joints, they only move a little bit, it's not much. But all the movements add up to give you global movement, so you can bend, twist, do all the things that you need to do. If I show you in the neck, then you can see they are very little dinky little joints there. And again, they move only a little bit, but they add up so that you can bend and twist, all right? These bubbles at the back are what you can feel through your skin. And if I turn you around, you can see more the weight-bearing part of your spine. So you've got the vertebral bodies, and then you've got the discs in between, okay? Purpose of your disc, 3 main purposes of your disc. So the disc is firstly a shock absorber. Secondly, it is a spacer which allows for enough room for this little dinky nerve to come out of this hole here. And then also it allows for the flexibility as well so that your body can bend and move. Okay? So obviously the discs have very, very important role. They are phenomenally strong. And the best I can describe it, they are a little bit like a poached egg. So you've got the white on the outside and then you've got the yolk on the inside. So the yolk on the inside allows for its flexibility, but the white on the outside are fibres that are overlapped, and that's where it gets its strength from, and they're like onion skin, so there's multiple layers. So your strength comes from the outside of the disc, okay? All right then, so you have the base of your skull, your brain would sit at the top, your spinal cord runs all the way down the centre, and then your nerves exit out of these holes at the side, and they go to supply every cell, every tissue, every single organ in your body. Nothing happens in your body without messages going from your brain, down your spinal cord, out to whatever they supply. But also, interestingly, there's a feedback mechanism. So what actually happens is messages come back from those cells, tissues and organs into the spinal cord, up to the brain to say what's actually happening. So you've got this constant feedback loop going on all of the time, okay? So that's a little bit of anatomy about the spine. Now, my job as a chiropractor is to make sure that all of this is functioning how it's supposed to. So why do you think that is? So the purpose is to make sure that the nerve supply to all those cells, tissues, organs, whatever they're going to supply, are working exactly how they're supposed to be working, okay? Now the most common cause of nerve interference is actually when these joints aren't moving how they're supposed to. Okay, so let's talk specifically about the sciatic nerve. So the sciatic nerve is actually made up of a group of nerves, okay? And this group of nerves comes from L4 all the way down to S3, okay? So lumbar segment 4, 5, S1, S2, and then S3, okay? And then what they do, they all group together and run down the leg. So I just want you to know that, because on the next, what I'm going to do, I'm going to show you a slide next so that you can actually visualize what it is, okay? In this picture, you can see how the sciatic nerve is made up of nerve fibers that come from L4 down to S3. So that's lumbar level 4 down to sacral level 3. In this image, what you can see is the sciatic nerve, which obviously is a very thick nerve, about the thickness of your thumb, and it's running underneath the piriformis muscle. Now, the piriformis muscle is like a fan shape that runs from the sacrum across to your hip, but it's a very big muscle that the sciatic nerve runs directly under. So if this muscle becomes tight, tense or taut, it could actually trap the sciatic nerve. Alright, so let's run through some of the causes of sciatica. So in this image you can see a disc herniation is one of the potential causes of sciatica, and that's because the central part of the disc, called the nucleus, can bulge out and actually push on the nerve itself. In this image you can see a spondylolisthesis, which is where one level of the spine slips on top of the other. This reduces the size of the hole that the nerve comes out of, causing potentially sciatic symptoms. Next you have spinal stenosis, and this is where the canal that the spinal cord runs through, so down the centre of your spine, becomes smaller. And so this decreases the amount of room that your spinal cord has actually got, and so that can compress the nerve as well. Direct trauma to the sciatic nerve can actually cause sciatic symptoms, so that's something to bear in mind as well. In this image, the piriformis muscle, which is the large muscle that runs from the sacrum over to your hip, is applying pressure directly to the sciatic nerve as the sciatic nerve runs underneath this big muscle. Spinal tumours can be another cause of sciatic pain, especially if the tumour is growing in the region where those nerves exit. So that's another thing to be aware of. But obviously when we run through our examination, we will be asking you many questions in order to determine whether you have something more sinister like this. And then finally, the vertebral subluxation, which is without a shadow of a doubt the most common cause of sciatic pain and nerve interference. Our job as chiropractors and osteopaths is to make sure that your spine is moving to the best of its ability, because that takes the pressure off the nerves. The nerves can then function how they're supposed to, and you just don't get the same symptoms. So what are the benefits of taking the pressure off the nerves? Well, they are absolutely huge. So it could range from anything from the pain relief itself to an increase in flexibility to more energy. But our primary goal as chiropractors and osteopaths and massage therapists is to make sure that you can do all the things that you love to do, all the things that make your life exciting and fun. So you can have no pain, but if you can't move properly, you still can't do the things that you enjoy doing. You can have no pain but not have the energy to do things that you want to do. So we see our role as making sure that your body functions to a level where you can do all the things that you love to do. And for myself and for the team, that's what we call your mojo. Your mojo is actually being able to do all the things that you love to do. All right, it's time to talk about the big mistake that people make when they have any sort of low back pain and sciatica, and we see this all the time. So when people have a low back problem, they will have inflamed tissues. The area is angry, it's not happy at all. And unfortunately, what some people do is they put heat on the area, whether it be a hot water bottle, or whether they go and have a soak in the bath, whatever it is. I can't stress this enough. This is the wrong thing to do. When you have angry tissues that are inflamed, the last thing you want to do is put heat on them. It's a little bit like putting a burnt thumb under the hot tap. It's the last thing that you would want to do, because that would make it more angry. So what we ask you to do instead is actually ice the area. Now, when we talk about ice therapy, we don't want you to freeze the area. So this is another common mistake that's made. People put the ice pack on up until it's no longer cold. That is not what you do when you're using an ice pack. So the key to it is to cool and soothe the area, but repeatedly. And it's that regular calming down of the tissues that means that you calm the area down without damaging anything and without stopping the healing. If you ice the area to the point where you're freezing it, you've actually slowed down and possibly stopped any healing from occurring, and then your problem lasts longer. So that's the last thing that you want to do. What we want to do is this cooling and soothing repeatedly. So I'll tell you now that the first 4 times that you ice the area, you will probably not notice anything at all. You'll go, this doesn't work. She's talking rubbish. Well, the thing is, it's once you hit number 5 and 6 that you'll go, okay, I can feel it starting to work now. So just be a little bit patient, but whatever you do not put heat on and do not freeze the area with the ice pack. When you're using an ice pack, by the way, make sure you've got some material around it. You do not want ice packs directly on your skin. You need some material there, okay? All right, so there we go, the big mistakes that people make when they have these types of conditions. Would you agree with me that everybody should have their spine and nervous system checked at least once in their lifetime? For me, it just makes perfect sense. So if you do want to get your spine and nervous system checked, then all you've got to do is pick up the phone, give us a call, or you can click on the button below.